So I believe that there are many universal challenges to teaching bioethics. And this comes across when we interact with many others who are responsible for teaching bioethics. And I'm connected with groups in the Far East, for example, who are heavily involved in this. Some of them are made by our own context. Some are very specific to the COVID pandemic that we've been facing. So if I could enumerate them, I think the one challenge, and this is certainly universal, is the idea of what we teach and what we do and how is it connected. So what I call this theory to practice disconnect, where students will turn around and say, well, you say this, but when we actually see things being practiced, that's not what is happening. So what you're saying is this ideal situation, and it's not really how problems are approached or resolved from an ethical lens, say, for example, in the clinical realm or even in the research realm. An issue. One of the ways that we've tried to address it is to have more of a continuous curriculum. You can't have something where students are introduced to a concept and then left alone with it to deal and grapple with the consequences of that on their own. If you continue to take them through and have a more longitudinal approach to it, allow them the opportunity to come back and discuss the real life cases that they are facing, maybe some of this disconnect can at least be addressed, if not alleviated. Other thing, and I've noticed this particularly in teaching a lot related to research ethics, some of these problems have been alleviated in other parts of the world, but things as simple as plagiarism or being forced to include certain people on as authors on paper. A lot of this tends to have a lot of cultural context and connotation that is difficult to break. So if you take the authorship issue, many will turn around and say, well, I am in no position to say to a supervisor that they haven't earned authorship on this paper, right? So again, there's a theory to practice disconnect when we say that there are certain authorship guidelines and the ethical thing to do and the best practices in research are to do it where only those who have earned it are authors. So some of those, and we published a paper on this, on how there are some cases, and CBEC has been fantastic in putting together, say, for example, the video cases that you have, because those really are problems that are contextual to us. Another challenge that I think is, again, perhaps more universal, is how you assess it. So assessment is an important thing, whether it's for the learner or the educator, but how to assess it. Assessing ethics is difficult. For me, the difficulty is more at the undergraduate level. At the graduate level, we've been able to do a lot related to open-ended questions or cases or scenarios, and really allow the students to come back to us with their own justifications of their ethical decision-making. So there's no necessarily right or wrong answer, as long as they're able to justify and use certain principles and frameworks to do that. So I find assessment at certain levels of bioethics to be a challenge. And I think that we may find that if we look in the literature, that's the case for others as well. And my final challenge, and it's not just related to bioethics, it is, of course, related to many other subjects as well, is this whole online teaching. And while it's really opened up during the pandemic, it's been really a game changer, but it's also been able to allow us to continue our programs, which otherwise would have had to stop. I find that ethics, and again, I'm talking particularly at the graduate level, I really want to connect with my students. I want to sit around a table. I want to have a discussion that's not scripted, that really allows them to open up and talk about their own experiences and be able to then have a more meaningful discourse around it. And I find that sometimes proves to be challenging in an online forum, particularly if you have more students in the room. So having a recognized core of individuals who are specifically trained who have the correct professional development to be able to deliver and not just know bioethics, but be able to teach it also, right? And assess it. They aren't necessarily only the same thing. You can't just be only a philosopher and feel like you know bioethics. There are certain pedagogies and assessment approaches that are important to appreciate as well. I think that there is a need, and there's a constant need across institutions in the country to be able to develop that cadre of professionals